I want to talk to a GP and a member of a key organisation, I would say, which is called Keep Our NHS Public. It's a non-party political organisation which campaigns against the ever-increasing privatisation and underfunding of the NHS. Dr. Louise Irvine. Hello, Louise. Welcome to the show.
Hello, Carol.
Are you looking forward to this report? Will it prove that a lot of what your organisation is saying is true?
Yes and no. I think it's important that this report happens and reviews what's been going on since 2010. What's been leaked so far is a tendency to blame the Lansley's Health and Social Care Act. Now, I campaigned vigorously against Lansley's Act, so I'm not defending it, but I don't think that is the main reason for the calamity, for the state of the NHS. I think it was a massive distraction. It was the idea that you just reform and therefore you can improve the NHS by reform. And also he wanted to bring in a much greater role for the private sector, which did not prove to have done any good whatsoever. But I think the other thing, and I think maybe Labour might be trying to avoid talking about this, is the year-on-year underfunding of the NHS through the years of austerity under the Conservative governments, first the coalition and the Conservative governments, and in the last 2 years, actual real terms cuts to funding. That's one of the big stories. And the problem is that is something that Labour is going to have to deal with, and its idea that it's going to be able to fix it by not spending more money on the NHS than the Tory spending plans, I just think that's unrealistic and unfeasible.
Now, Wes Streeting was obviously doing the media rounds this morning, and he came on my colleague Lewis Goodall's show earlier, and he was saying that it's going to take not just investment, we're talking about money so far, but also reform of the system. He says more money won't sort it, reform alone won't sort it, but both together have a chance. And I just want to go through the three big shifts which he has been talking about and get your opinion on these, if I may, Louise. He says he wants a big shift in the focus from sickness, i.e. treating people who are already ill, to prevention. What do you feel about that?
Of course, prevention is really important, and many of the big killers and the biggest causes of long-term disability are preventable with proper public health and proper general practice and community investment. But it takes many years. You know, a long-term campaign to reduce smoking has been happening and has been quite effective, and over the years that will decrease cardiovascular disease and lung cancer, etc. But it takes a long time for those initiatives to actually be realised in terms of better health and better life expectancy. In the meantime, we still have a lot of people who are getting very sick, and they're just lining up in trolleys in corridors in A&E because there aren't any beds for them. And there aren't beds because about 30% of beds in some places are occupied by people who should be being discharged, but there's no social care for them. So, you know, I think all very well investing in prevention, but it has to be double investment. Invest in prevention, but at the same time, you have to invest in acute care because people really are suffering from the lack of that now.
The second shift, and I understand all of that, and we all know, I mean, everybody listening will know, and please do ring in to tell me your stories of people who have been on trolleys for hours, and sometimes days when they have been acutely ill, and the staff are trying their best, but it seems that the resources and the beds just aren't there. His second shift that he proposes is from hospitals to GPs and community services. And, you know, I'm in my 60s, Louise, so I can remember a time, 20 years ago when you would ring up the doctor and it would be today. What time today do you want to see the GP? Or we can at most do it tomorrow. And people were complaining because they couldn't book up a week in advance, that they had to have their appointment within 48 hours. But it is a far, far cry from that now.
Well, I'm in my 60s too, and I've been a GP for 30 years. Yes. And I do remember those days that you describe, and it was a real joy and a pleasure to be a GP in that situation where you could see patients promptly and you could have real continuity of care and get to know your patients and their families. The problem is that it's not that there are fewer GP consultations now than there were then. There are many, many more GP consultations now than then. There are fewer GPs per head of population than in those days. And although we've got the help from fantastic other clinicians such as pharmacists, practice nurses, etc., that isn't enough to enable us to do our job as well as we can, because an awful lot of care that used to be done in hospitals is now done in the community in general practice. Most care for long-term conditions. I remember the days when anybody with high blood pressure that wasn't managed on a very simple medication, you would refer them to a hospital clinic. You'd refer everybody with chronic obstructive pulmonary disease to hospital. You'd refer probably most diabetics, including type 2 diabetics, to hospital. Now we do all that in general practice, but the funding has not followed that shift in responsibility into general practice. The real terms, a percentage of NHS funding going to general practice has plummeted. And so I do agree. We do need a big investment in not just general practice, but community care, which includes people like district nurses, etc., to really make a difference. That won't stop the really seriously ill patients who GPs can't manage, because there are things I can't do, actually not being able to access the care they need in the NHS acute care hospitals and lying on trolleys waiting to be seen. So we need investment in primary care, community care, and also in hospital care.
You are a member, as I said earlier, of Keep Our NHS Public, and I just wanted to throw some numbers at you, if I may. This was from the Public Accounts Committee, I think, last year, and the annual accounts for the DHSC show that nearly 3/4 of the money it spent on PPE during the pandemic has been written off. So the figures showed £9.9 billion of the £13.6 billion spent in total on PPE during the pandemic was unusable, or its value is now less than the government paid for it. Then we had 37 billion on a useless test and trace system. Many of the contracts from the NHS are given to Tory donors. We know this, and associates who have significant interest in various companies. Frank Hester's company, for instance, had well over £100 million in contracts, then donated 15 million to the Tories. And the analysis by We Own It, which I follow, says that around about £10 million a week since 2012 has left the NHS and gone straight into profits by private healthcare companies. Can I just ask for your opinion from Keep Our NHS Public on all of that, please?
Yes, I really agree with that. And Keep Our NHS Public works quite closely with We Own It. And it's so scandalous. Sometimes, with big numbers, I'm sure you know that, Carol, people's eyes glaze over, don't they? You talk about billions.
What does it mean?
What does it really mean? Yeah. And it's actually absolutely disgusting, because during the COVID pandemic, we were desperate as GPs and as healthcare professionals. We were desperate that there should be good PPE. And many healthcare workers suffered and died because of lack of good access to PPE. But also, the test and trace system that could have been done much better. Other countries manage it much better, and that could have saved lives. So I think it's disgusting and despicable, but it also shows that it's not right for the NHS to say, or for Wes Streeting to say, we can use spare capacity in the private sector to try to shorten NHS waiting lists, partly because the experience so far of using the private sector has not been good. And even in the old days, under the last Labour government, of the independent sector treatment centres, which Lord Darcy brought in, there was a national audit committee that found that it didn't actually contribute significantly to reducing waiting times there or cost less. So going forward, I don't think the private sector even has the capacity. Its staff come from the NHS. Its doctors come already working in the NHS. And it's got about 8,000 beds, which are mainly full. It can't suddenly overnight bin a whole lot of new beds. Yes. It will want to charge higher rates in order to maintain profits than the NHS can provide care for. So I think that's just a false hope. And we need to go right back to saying, let's invest in our NHS, as the fundamental model isn't broken. I would like to say that. The model of free care at the point of need, publicly provided, by
It's not
dedicated
broken.
professional service.
It's
That is
not
not broken. Not broken. I think
Which is a different message to the one that
Yes.
Keir Starmer is giving out. Louise, thank you so much. We could talk to you forever, but I don't have time. We've got to go because we've got lots of calls coming in. But thank you very much indeed, GP and member of Keep Our NHS Public, Dr. Louise Irvine.